Welcome to Blue Briefing. Our video will look at an important paper in the American Journal of Respiratory and Critical Care Medicine. Here, we discuss lung injury prediction model in bone marrow transplantation, a multi-center cohort study by researchers from Mayo Clinic, Rochester, Minnesota, Phoenix, Arizona, and Jacksonville, Florida. Pulmonary complications play a key role in non-relapse mortality after hematopoietic stem cell transplantation, or HCT. Although the overall treatment outcomes of acute respiratory failure, or ARF, have improved over the past few decades, the prognosis of HCT patients with ARF remains poor. It is thus crucial to identify high-risk patients to investigate the underlying mechanism and improve the management of post-transplantation respiratory failure syndromes. To fill this gap, researchers at the Mayo Clinic in Rochester, Phoenix, and Jacksonville conducted a multi-center cohort study to identify patients at high risk of post-HCT ARF needing invasive mechanical ventilation, IMV, or non-invasive ventilation, NIV. They recruited 2,450 patients who underwent HCT between January 1, 2019 and December 31, 2021, and who were hospitalized within 1 year of transplant. Patients were divided into a training cohort and a test cohort. The researchers developed and validated a 22-point prediction model incorporating 11 pre-transplantation, 11 post-transplantation, or early in-hospital predictors. This model reliably predicted the development of acute respiratory distress syndrome post-transplant and the need for invasive and/or non-invasive ventilation. The model was also modestly successful at predicting milder respiratory failure, requiring greater than or equal to 4 liters of supplemental oxygen. The performance of the developed score was comparable between the training group and the more diverse test cohort, suggesting generalizability. Overall, this novel model can effectively and reliably predict the risk of ARF in HCT, which may be an important tool to identify and enroll patients into pharmacopreventive trials and improve outcomes in post-transplant lung injury disorders. For more details, please read the article by Dr. Hersevich and colleagues. Thank you for watching Blue Briefing.